Come on.
How you feel? How you feel?
I'm feeling good. Spin me, spin me.
Got you.
Oh, goodness. Oh.
Hello, thank you for joining us for Road to Recovery on the Lancaster School Network. It is a privilege to have you joining us here for this program that attempts to provide hope and help and healing and wholeness to those who are struggling with addiction or family members or friends of those who are struggling. We've received so many comments from people at the gym or through email or phone calls or text, and we so appreciate your support of this Road to Recovery program. We really want this program to be used as a source of encouragement for those who are going through a very challenging time. My name is Steve Rao, and I have the privilege of co-hosting this program with the Executive Director of the Recovery Center, Tricia Saunders. Welcome back to Road to Recovery, Tricia.
Well, thank you. It's good to be here.
It is great to have you joining us. One of the things we love about this program is bringing guests on the show that have forgotten more about addiction and recovery than most of us know, isn't it?
That's right, absolutely.
And today is one of those days. We bring to you Orman Hall. He is working at the state level these days, but got his start as the Alcohol, Drug Addicted Mental Health Director here in Fairfield County. Orman Hall, welcome to Road to Recovery.
Thanks for having me, Steve.
Give me your official title at the state level.
Well, I am currently the director of the Ohio Department of Alcohol and Drug Addiction Services.
Very good. And how long have you been there? When did you start?
In January of 2011, just a fairly brief period of time.
Very good. Well, the governor, Kasich, there's always a lot of debate whether they make good decisions or bad decisions. Bringing Orman Hall to the capital city was an outstanding decision.
Well, the jury may still be out on that one.
There is no jury out on it. I think the jury is seated and has already made their decision. It was a wonderful decision that he made. If you'd be willing to come back on another show and talk to us about your work at the state level, you'd be willing to do that?
I would be honored to do that.
Because today, I'd like to learn a little bit about your work here in Fairfield County. First of all, how long have you lived in Fairfield County?
Since, October of 1989.
89, so quite a few years.
A year or two.
Yes, it's been a few years. Where did you get your training as it relates to working in the alcohol, drug addicted mental health area?
Well, actually, Steve, I am not a counselor per se. My background is in research and evaluation.
Okay.
In the mental health and drug and alcohol field. So and as a result of some work that I'd previously done around needs assessment and planning, I was able to secure the ADAM Board Director's job here in Fairfield County. I've always relied on people like Tricia to help me through in terms of some of the dynamics of addiction.
Very good. So you obviously had some training in this area. How did that process happen for you?
My academic background is from Marshall University. I studied sociology and political science with kind of an emphasis in statistical analysis.
Very good. And when did you get hired on at the ADAM Board?
In the fall of 1989.
Very good.
Again, a year or two ago.
That was a few years ago. And over your time working there at the ADAM Board, what is some of the significant things that you've seen develop over that time?
Well, probably the most significant, the most important sea change that occurred here in Fairfield County from the standpoint of addiction was the emergence of opiate addiction as a problem in our community. And sort of reflecting back on our experience, again, my background is in research and evaluation, so we statistically tracked trends, data trends over a number of years. And as late as 1999, were you at the Recovery Center in 99, Trish?
A little bit later than that.
Oh, okay, all right. I keep forgetting how young you are.
Yeah, she's the youngest one in the room.
I hate that. I hate it when that happens. But in 1999, we were able to identify 4 people who approached the Recovery Center because they were addicted to either heroin or prescription opiates.
Okay.
4 people. Now, if you flash forward to 2010, and Tricia knows these statistics well, in 2010, 67% of everyone that presented at the Recovery Center, they presented there because they were addicted to prescription opiates or heroin. And by the way, they're the same thing. And the Recovery Center, because of such extreme demand, was in a position where they were turning away about 200 people per month. So we went from 4 people to 67% of everybody in treatment being there because they're addicted to heroin or opiates.
And I'm guessing 67% is a lot higher than 4.
It sure is.
Yeah.
It's pretty hard to even imagine that happened. And I think that it was really interesting, too, because your background, I think, lent very well to us being aware of what, how quickly the trends were changing at that time, far more so than most of the state. I think we kind of had an edge there because of that information.
And I say we, I shouldn't say we. Tricia and her team were pioneers in terms of the development of treatment approaches for persons that are struggling with opiate addiction. They were the Recovery Center was one of the very first centers in the state to sort of adopt the practice of medication-assisted treatment, which I think is profoundly important from the standpoint of providing successful care to people that are struggling with opiate addiction.
And we had an ADA board director at that time who was willing to work with us on that and help support funding for a program. So that's been very helpful, and it's really reached a lot of people. So
it really is a partnership, isn't it?
It sure
we talk
is.
about it a lot.
We talk about that a lot on here.
Yes.
We all work together, and we all have a piece in this important.
So obviously you had a very important part to play in working with Tricia and her staff and volunteers at the Recovery Center. Fairfield County was not unique, really, in this process. You call Tricia Saunders and the Recovery Center a pioneer, and appropriately so, but we were not alone in this battle against opiate and heroin addiction, were we?
Clearly, we were not alone. The opiate addiction is pervasive in our state right now. It's funny, when we first started dealing with it, I think we believed that we were unique because data was not very good around Ohio. We had good data in Fairfield County. Most communities did not. I think the general sort of thinking was that somehow Fairfield County was unusual. We, in fact, were not unusual. Most communities, especially in the southern part of our state, are struggling very substantially with opiate and heroin addiction.
One of our problems, Tricia, is that we acknowledged that we had a problem where others maybe were avoiding the issue, and it looked like maybe we were, the worst in the country or the worst in the state. Is that right?
Correct, or they didn't even know at the time. They didn't have the information, the data to show that they had a problem.
To give you a sense, Steve, we often point to Scioto County. For a number of reasons. The problem is more extreme down there, but they also had 11 pain clinics that were there solely to feed people's addiction. And they were pushing out massive numbers of prescription opiates and benzodiazepines. We've closed those clinics. But in 2010, the 79,000 residents of Scioto County were prescribed 9.7 million doses of prescription opiates.
Wow.
That is 123 doses for every single human being that lives in that community.
Yeah, that's man, woman, and child in that community.
Every man, woman, and child.
Could have gotten 123 pills.
If they were distributed equally, every single person there would have received 123 pills.
Yeah. So clearly, we weren't the worst in the state or the worst in the country.
Not even remotely the worst in the state.
Yeah. To what do you attribute that challenge and that change from what you saw when you first came to the ADA board in 1989 to that 2010 period of time? What caused that big change?
That's a great question. I think starting around 1997, and this is not just Ohio, or certainly not just Fairfield County, there were changes in the practice of medicine. We started looking at pain in ways that were completely different. Our healthcare system started looking at the treatment of pain in different ways. And there was a pharmaceutical product known as OxyContin that many people believed to be a non-addictive form of narcotic. Well, we know now that it was a very highly addictive narcotic. But there were rule changes in terms of intractable pain that were implemented here and in many states around the country. And as a result, what we saw here in Ohio was about a tenfold increase, a 1,000% increase in the use of prescription opiates to treat chronic pain. And the end result of that particular policy change in our healthcare system has been a rapid and significant, serious increase in the number of people struggling with opiate and heroin addiction in our state.
What is your research showing you from the recreational side of things? You're talking about folks who had back surgery or other surgeries, and they took it maybe legitimately, at least at the beginning,
right.
And then developed an addiction and then kind of spiraled down from there. But we know lots of stories about people who involve themselves recreationally, and that certainly had a terrible end result to that as well. To what might you attribute, or your research point to that kind of use?
Well, I think there are a couple things here, and Trish, please feel free to chime in. But looking at it from a data perspective, the most recent data that I've seen indicates that there are about 9 million people in our society that are receiving prescription opiates for medical purposes, and that there are about 5 million recreational users.
Oh, wow.
So there's about one recreational user for every 2 medical users. And I also think, kind of going back to, I think, part of your question, there are a number of people who become highly dependent on opiates from from the medical use. And I think the other element to all of this is, for a number of years, we tended to discount the degree to which opiates are addictive because they're a part of our healthcare system.
Sure.
We know much better now. We know that prescription opiates are highly addictive and very similar, in fact, almost identical to heroin at the chemical level.
And we've heard of this, haven't we, Tricia, where people say, oh, a doctor gave it to me, so even if I used a little more than I should, it's not a problem.
Right, and that's typically what we see. And I think most people that we work with tend to have some medical need, somewhere in the past that kind of got the ball rolling, unfortunately.
Yep.
And we've also seen the average age of onset go from age 45 down to the low 20s. Most of the people that we work with started using opiates before they were 21, so very young.
Do you think that was related to surgeries that they had, or issues, back problems, that kind of thing? Or do you think maybe it started more recreational?
The vast majority of them, they had some medical reason. It could have been from the dentist or whoever,
Sure.
but there was some reason that got it started outside of recreational. But it doesn't take very long now for them to switch over to the heroin. And like Director Hall said, it's all the same thing.
No question. We love to offer hope and help and healing and wholeness here, and I know you've seen some positive things, especially here in Fairfield County. Talk to us about the positive things that have happened here in Fairfield County, that now, here in this time frame, things are a lot better than they were, say, when you came on board in 1989, or that trend you saw starting in 1999.
Well, what I'm really impressed with is the vision that people like Tricia and her staff have around the treatment of opiate addiction. And what makes me hopeful about Fairfield County and much of our state is the commitment to adopt evidence-based practices in terms of how we treat this disorder. Opiate addiction is, at least in my mind, the most serious of addictions. And the Recovery Center has demonstrated time and time again that they're willing to step back, identify and use those practices that are most likely to result in people having the best chance for long-term sustained recovery. So I'm hopeful that if we can ever find a way to provide the Recovery Center with the resources that they need, that agency will do the right kind of work to make sure that the greatest number of people have a good opportunity for recovery.
And we've been very blessed because I think that the challenges that we've faced have been met very well at the state level with Governor Kasich and your work with him, that people have been very open-minded to new ways of doing things, and to closing down the pill mills obviously was a big one. But a lot of things have happened at the state level that have helped us to do our job in a better manner, and we're very grateful for that.
No question. I read in the Lancaster Gazette, other papers, and every article I've ever read, I saw Orman Hall's fingerprints all over what was being done there. And we've got about a minute left. If you were to offer hope to those struggling with addiction or family members of those who are struggling, what hope might you provide from your experience and your research that's telling you there is hope and help for those who are struggling?
Well, I do, and by the way, I do absolutely believe that everyone has good reason to be hopeful. The nature of this particular form of addiction is really serious. People need to be very concerned about it. But with the right kind of treatment, which from my perspective, for most people, is counseling and medication, the majority of these people can get better and can eventually be in sustained long-term recovery.
That's the kind of hope we're looking for right there. Orman Hall, Director of the Ohio Department of Drug Addiction and Alcohol Services, thank you for coming on with us. Would you be willing to come back and talk to us about your work at the state level?
I would be honored to do that, sir.
Outstanding. Thank you for being here today, talking to us about your work in Fairfield County. That'll wrap up this Road to Recovery show. Thank you for joining us. If you are struggling or a family member is struggling, give the Recovery Center a call. Their number is 740-687-4500. That's 740-687-4500. For Orman Hall and Tricia Saunders, the Executive Director of the Recovery Center, I'm Steve Rao, as we continue on this journey right here on this road to recovery.
We are different. Society should aspire to be more like us.
Be part of the first class. Get energized. Get outside.
Hold on, guys. It's gonna get bumpy.
And get moving. Experience the power of physical activity. Join the movement at ActionHeroAlliance.com.